make sure you subscribe to become part of the gang. Like, period. What's up, Aaliyah gang? It's the girl Aaliyah, and we're back with another video for today, okay? And if you don't know me, if this is your first time seeing my face, make sure you subscribe. And if you're new to my channel, shake my hand. Hello. All right, y'all, so we're back with another video for today. This is a different type of video than what I usually film on my channel. And if you read the title, yes, it's true. I started going to therapy. Well, I've been going to therapy. I started going to therapy of January this year, specifically January 18th, and I've been going ever since. And today we just want to talk about me going to therapy. This is like a different type of video. Like, I've never done this before on my channel. It's more so like informal. Try to do my research to give you guys like the best information that I can. If you're new to my channel, usually I'll film like makeup videos. I will film like makeup tutorials, story times, or like challenges of me like trying new things and stuff like that. But today I just really wanted to sit down with you guys and like open up to you guys and just talk about me going to therapy, because I just felt like it's something that you guys should know, and it's nothing to be ashamed of. It's nothing to hide, really. So that's why I decided to talk about it on my channel today. So guys, so yes, I am going to therapy. Honestly, I truly love it, and I'm so happy that I've been going, because it's been helping me deal with a lot of past problems in my life and stuff that I haven't really talked about with anybody. So y'all, a little book here with all my notes. You can't even see it. But today, like I said, I just wanted to talk about me going to therapy. I also wanted to talk about the different kinds of therapy, and I'm gonna get into like the different definitions. So specifically, like what I'm doing, like what type of therapy I'm going through, is psychotherapy. And I found this definition on dictionary.com, but I didn't like it. By the way, I'm going to be posting like all the websites like where I get my information from, and no, I didn't get it out of my ass. So like I said, I've been going to psychotherapy. And what is that exactly? Like, what is that? Like, is that crazy therapy? I'm gonna tell you guys the definition right now. For dictionary.com, I got the definition of psychotherapy is the treatment of psychological disorders or maladjustments by a professional technique, as psychoanalysis, group therapy, or behavioral therapy. So I didn't really like that definition, but I decided to like go in deeper and really search up what maladjustment is, because I didn't know what it was at the time. And I was like, maladjustment, like what does that mean? So maladjustment means bad or unsatisfactory adjustment. Related words to that is like breakdown, abnormality, and depression. So I got the definition off another website because I didn't really like that definition, but some people may like it, but I just didn't like how like it was worded. Like, I felt like they were just trying to say like psychotherapy just means like we're just going to treat your disorder and a breakdown that you're going through. You know what I mean? Like, that's how I took it. So I decided to do further research. I got another definition off of myoclinic.com, and that definition is: psychotherapy is a general term for treating mental health problems by talking to a psychiatrist, psychologist, or other mental health provider. During psychotherapy, you learn about your condition, your moods, feelings, thoughts, and behaviors. Psychotherapy helps you learn how to take control of your life and respond to challenging situations with healthy coping skills. So like, I just love that definition, because that's exactly like what it is. Like, the first definition didn't really like go in depth with it, but I feel like the second definition really did. So I just feel like that's exactly what it is. Like, it's just like it says, you learn about your condition, you learn about your moods, you learn about your feelings, thoughts, your behaviors. It helps you learn how to take control of your life and how to deal with your challenges that are coming in your life, instead of just saying like the other definition that you're getting treated for your disorder or maladjustments by professional technique. Like, no, you're learning how to deal with what's going on in your life. You're learning about your moods, you're learning about your feelings, why you feel the way you feel, what's causing you to feel the way you feel, how can you overcome those challenges. It's literally like, that's what it is, and that's literally what I'm doing. I'm going through psychotherapy to learn about why I feel the way I feel during certain situations. What thinking errors may I have that I can change? Learning about like how can you cope with certain situations in your life? How can you overcome those situations? How can you not make those situations overcome you and make you depressed all the time? You know what I'm saying? Like, how can I become a better person with these situations in my life without feeling I just need to, like, you know, crawl up in a ball? Because honestly, guys, before therapy, all I wanted to do was just stay in my room and not talk to nobody. It's teaching me how to cope with what's been going on in my life, and I'm not sure if I'm actually gonna like go into depth with that. Maybe I will. I don't really call it psychotherapy, I just call it therapy, but in depth, that's what it is. Psychotherapy. Therapy is just teaching me how to deal with my past problems, for example, like my past relationships, and basically people that hurt me a lot, and then how to deal with forgiveness, like forgiving people and just not being angry over that, like taking control of your life. Like I said, taking control of your emotions, learning how to just be in control, pretty much. Now we're going to talk about the different types of psychotherapy. NAMINH.org, which stands for National Alliance of Mental Illness. NH stands for New Hampshire, I believe. If I'm wrong, I'll put it somewhere on the screen. But anyways, we're going to be talking about the 6 different types of therapies. Therapists offer many types of psychotherapy. Some people respond better to one type of therapy than another. So a psychotherapist will take things like the nature of the problem being treated and the person's personality into account when determining which treatment will be most effective. So basically, type of therapy may not work for another person. Like, what worked for me may not work for you. Like, it's either it's gonna work for you or it's not gonna work for you, and if it's not gonna work for you, then gonna try a different approach, pretty much. So first I'm going to list the different types of therapy, and then we're going to go over it. One is cognitive behavioral therapy, dialectical behavioral therapy, eye movement desensitization and reprocessing therapy, exposure therapy, interpersonal therapy, mentalization-based therapy, psychodynamic psychotherapy, and therapy beds. Cognitive behavioral therapy focuses on exploring the relationship between a person's thoughts, feelings, and behaviors. During CBT, a therapist will actively work with a person to uncover unhealthy patterns of thought and how they may be causing self-destructive behaviors and beliefs. By addressing these patterns, the person and therapist can work together to develop constructive ways of thinking that will produce healthier behaviors and beliefs. So I feel like this is kind of the type of therapy that I am going through right now. During my sessions, we basically go over like what's bothering me, and we uncover any unhealthy thinking that I may have, and go over my thinking errors and what I could have done to make the situation better, or what could I have said to make the situation a little better instead of doing what I did, or how can I think of this a different way rather than thinking of it this way. Number 2, dialectical behavior therapy. DBT was originally developed to treat chronically suicidal individuals with borderline personality disorder. Over time, DBT has been adapted to treat people with multiple different mental health conditions. DBT is heavily based on CBT with one big exception. It emphasizes validation or accepting uncomfortable thoughts, feelings, and behaviors instead of struggling with them. By having an individual come to terms with the troubling emotions or behaviors that they struggle with, change no longer appears impossible, and they can work with their therapist to create a gradual plan of recovery. Number 3, eye movement desensitization and reprocessing therapy. EMDR is used to treat PTSD, and if you guys don't know what that is post-traumatic stress disorder. A number of studies have shown it can reduce the emotional distress resulting from traumatic memories. EMDR replaces negative emotional reactions to difficult memories with less charged or positive reactions or beliefs. Performing a series of back and forth repetitive eye movements for 20 to 30 seconds can help individuals change these emotional reactions. Number 4, exposure therapy. Exposure therapy is a type of cognitive behavioral therapy that is most frequently used to treat OCD, PTSD, and phobias. During treatment, a person who works with the therapist to identify the triggers of their anxieties and learn techniques to avoid performing rituals or becoming anxious when they are exposed to them. The person then confronts these triggers in a controlled environment where they can safely practice implementing these strategies. Number 5, interpersonal therapy. Interpersonal therapy focuses on the relationship a person has with others with the goal of improving their interpersonal skills. The therapist helps people evaluate their social interactions and recognize negative patterns like social isolation or aggression. It ultimately helps them learn strategies for understanding and interacting positively with others. Interpersonal therapy is most often used to treat depression but may be recommended with other mental health conditions. 6. Mentalization-based therapy. Mentalization-based therapy, aka MBT, can bring long-term improvement to people with BPD. According to randomized clinical trials, MBT is a kind of psychotherapy that engages and exercises the important skill called mentalizing. Mentalizing refers to the initiative process that gives us a sense of self. When people consciously perceive and understand their own inner feelings and thoughts, people also use this skill to perceive the behavior of others and to speculate about their feelings and thoughts. Mentalizing thus plays as an essential role in helping us connect with other people. 7. Psychodynamic psychotherapy. The goal of psychodynamic therapy is to recognize negative patterns of behavior and feelings that are rooted in past experiences and resolve them. This type of therapy often uses open-ended questions and free association so that people have the opportunity to discuss whatever is on their minds. The therapist then works with the person to sift through these thoughts and identify unconscious patterns of negative behavior or feelings and how they have been caused or influenced by past experiences and unresolved feelings. By bringing these associations to the person's attention, they can learn to overcome the unhelpful behaviors and feelings that they caused. So like after reading that, I feel like this kind of reminds me of my sessions as well. The part where they said that the therapist used open-ended questions so that the person can freely express themselves, pretty much. That's basically what my therapy sessions are about. Like, it's not like by the book. It's not like certain questions that she asks. I'm sorry, that's right, hold on. It's not like certain questions that she asks like every single time. Like, it's different, it's free. Like, I can express myself, she can express herself, obviously by like not telling me like what I want to hear, but like it's not like by the book, and it's not like she's reading off a piece of paper or reading out of the book. Like, it's free of expression. And the last one is therapy pets. Spending time with domestic animals can reduce symptoms of anxiety, depression, fatigue, and pain for many people. Hospitals, nursing homes, and other medical facilities sometimes make use of this effect by offering therapy animals. Trained therapy pets accompanied by a handler can offer structured animal-assisted therapy or simply visit people to provide comfort, which is like, I wish I would love to just sit down and have a whole bunch of dogs just run to me. Like, I feel like that is definitely therapy because like dogs are so cute. So those were the types of different psychotherapies, and honestly I feel like what I'm doing is cognitive behavioral therapy and a little bit of psychodynamic psychotherapy. Like I said in the beginning, like one type of method may work for you and not for another person, or it may work for another person and not for you. Like, it's cool. Like, whatever works for you works for you, and it doesn't just have to be like one type of thing. Like I said, for me, like for my therapy sessions, all I can say is it's not by the book. Like, it's free of expression. Like, I can go there and like express myself and just cry. Like, therapy is literally like my peace. Like, I'm so serious. That was the different definitions of psychotherapy. So comment down below what else you want to see from me. If you want to hear something else instead of therapy, or like what other questions that you have for me for therapy, comment down below, okay? And I will get to those questions and I will get to those videos. Make sure you subscribe to become part of the gang, like, period.